we have with us Manoj Chandran, who is the founding CEO of the Swan Foundation. He has over 25 years of experience in a wide range of areas, including journalism, strategy, marketing, and leadership. Thank you, Manoj, for joining us.
It's a pleasure, Kumar. Thank you for inviting me over.
Manoj, it's needless to say that the pandemic has been a very, very trying time for people across the world, and more so in India, with the kind of conditions and realities that people are facing. What has been your experience in the last 6 to 8 months in terms of both the issues that are coming up and the kind of responses that the organized space, such as yourselves and corporates, are sort of bringing to the fore?
Sure, Kumar. So yes, I mean, one good thing that has happened for those who are working in the mental health care space during the last few months is that the pandemic has brought, in many ways, mental health as a subject to the public, and there's a lot of discussion, a lot of energy around this subject, and which is really good. So looking at pandemic per se, we human beings were never trained, or we were never prepared to be able to handle, be it the pandemic or the social changes that followed the pandemic, that followed the virus. And if you speak with mental health professionals, they will tell us that we don't like sudden changes. Human beings can't handle sudden changes if you're not prepared for it. And long periods of stress can create mental health issues, which is what is being seen now. When you look at calls to helplines as an indication of the increase in number of in the number of mental health issues due to the pandemic, clearly there is a rise in some areas, but it is also the fact that the cases of mental health issues which were already there, we are now getting discussed. For instance, there is this whole thing about parenting, for instance, or relationship issues have come up in a big way. Because suddenly we are finding all the members of the family in the house for a long period of time, and they are not able to negotiate their own spaces, be it the father, the mother, other members of the family, and the children too. So there is certainly that whole need for mental health care, particularly during adversities, social adversities, has really become an important one that policymakers, decision makers, and service providers must begin to address.
You said something very important, that a lot of those mental health issues were always there, even before the pandemic. It's just that the time to sort of stop and think and maybe introspect and self-reflect, that has brought a lot of these past traumas, PTSD, or even anxiety up to the surface. Some of it over the years, because of our fast-paced lives, the rigmarole gets pushed under the carpet. Are you seeing a lot of that happening, where people who were not, let's say, immediately before the pandemic in a mental health situation are now coming in and saying, something happened to me many years ago, I've been facing issues earlier, and now I have the ability to stop and think about them and do something about them?
So that's a very important point to be discussed, Kumar, in mental health care. Essentially, the big issue about mental health care is that 90% of those with mental health issues in India will never receive professional help. Of the 10% who do, most of them do so after a long, prolonged delay. Now look at it, 90% of people will never ever come in front of a professional for services, for getting treatment or getting a chance to recover from the problem they have. Now, why is it so? One, of course, we can always blame that the service infrastructure in the company has been so dismal, so lacking, that we couldn't expect these people to be able to get access to those services. But at the end, the other end of this whole problem is also the fact that there hasn't been the demand for services. So today, a year ago, if I had a problem with mental health issue, I wouldn't even know that I have to demand for services. I need to look out and say that, is there a psychologist available? Is there a psychiatrist available? Or is there anybody else who can handle my problem? Now we are providing, because there's a lot of discussion, because there is a little bit of a visibility that has begun to happen. Now, we're not saying that everything that is being discussed is positive and right in the right direction, but at least that has begun to happen. The churn is being seen at the moment due to the pandemic, which is a great sign, a great indication of the fact of, it's a great encouragement for those people with problems. Because to say that suddenly they are saying that, wow, you're discussing mental health. Can I say that I think I have this problem and I need help? So people with mental health problems are also looking for an environment which is conducive, an environment which is supportive, where they see good signs that they can open up, speak out and seek help without finding a reprisal or a stigmatic kind of a reaction from people around them. And this is, in some way, at least in some pockets, we have begun to see this happening due to the pandemic.
Right. You very briefly touched upon the fact that not everything that's happening is obviously in the right direction. And, there is some truth to that, because in the last year or two, it has, in certain parts of the media and certain sections of the society, one can say that the pendulum has actually swung to the other extreme, where it's almost become a thing or fashionable to say that, oh, I'm suffering from a mental health disorder and I want to be on, like you said, be on 10 fora talking about it, right? Almost like a badge which you can wear.
Yes.
And do you see that sort of waning out over time, or is that something which is a little more deeply entrenched?
So Kumar, if you look at the mental health space, our decisions that we make, and when you say we, not just those with mental health problem or their caregivers, even we who may not be connected seemingly with the problem, but are stakeholders, because we are carrying a certain view, a certain notion and a belief around mental health and attitude towards those with the problem. Now, what do we do? And all our decisions that we make around mental health are based on the notions we carry. And suddenly, and they were all like, caught in the kind of very high pressure can, and suddenly, because there's so much of visibility and energy, that's getting burst open. And when you see that happening, it's very obvious that those notions which were not very positive, those beliefs that were not very supportive, will get some kind of a platform to be aired. So I'm not very surprised with the kind of reaction, the kind of discussions that are getting done, which may sound and feel like, oh my God, we are going 1,000 years back in our views. But at least we're speaking. At least there are citizens who are pointing out that, no, you're not right. This is not how you discuss. This is not how you bring out a certain kind of a stigmatic commentary on somebody with mental health issue. This is not the language, the communication you make. I mean, I'm so happy about it that citizens are speaking and correcting people on Twitter to say that, no, don't say that. Don't say committed suicide. Don't label somebody who you want to fight with a mental illness, or generalize mental illness, and or use general mental health as an adjective. These are great steps forward, I would say, Kumar.
Sure. And, speaking of which, when you talk about, let's say, social media and the entire narrative about mental health, some would believe that, yes, India is, many decades behind in terms of facilities and resources for mental health, for both at the caregiver end as well as at the, patient end. I think there's also an opportunity for India to sort of do things differently. We don't always have to go down the, I could say, the hackneyed path. I would have seen 100 odd debates in the last few years where big pharma and their, I would blatantly say lobbyists are crying themselves hoarse, saying that we need more psychiatrists, we need more mental health beds, we need more facilities. This is how it's done in the US. This is what the top Ivy League colleges or universities of the US are saying. This is what the professors are saying. Well, but the data of the experience of all of these facilities is the other way around. If you look at what's happened in that part of the world, they are the mecca for mental health, drugs, right? And even with all that infrastructure, the problem has only gotten worse. Forget about getting cured. So, what is your view in terms of some of the areas or some of the things that India might be able to do differently and not follow that same path and that Western view of global mental health? There has to be an Indian view, right? And I also say this from the perspective that we have access to things like yoga or meditation or pranayama or Ayurveda or just our way of life, which has existed for thousands of years compared to, let's say, modern day psychiatry, at least the a drug based method of psychiatry, which is just what 60, 70 years ago. So putting those things in perspective, what do you think India has an opportunity to do?
So that's a very interesting perspective, actually, Kumar. So there are two aspects to this whole problem that, as I see it, one is that from the sheer volume of those people with mental health issue, it's large for India to address, and then we have a very lacking kind of service infrastructure that we have. Now, we can't wait for the service infrastructure to improve to say that we are now ready to be able to serve all those with mental health problems. That is not going to happen. So depending and relying entirely on ramping up our service infrastructure to say, now we're ready to handle mental health care, that will not solve the problem. So clearly, India, while of course, I wouldn't deny that there is a need for us to build strength into the service infrastructure, but we have to look at opportunity to leapfrog into a whole new area of solution.
Sure.
What are those? They could be about technology-enabled solutions. They could require a lot more of innovation, and not just pick up something that has already happened. Look at, just to give an example, very small example though, but very important one. Suddenly in the last 2 to 3 years, there is an increase, at least in urban spaces, in the demand for online counseling.
True.
And so why is the demand happening? Why is that? And then just as the demand is happening, there are also suppliers available now.
True.
So because there is the demand happening, there you will find many of the service providers are ready to offer their services, counseling services or psychology services online, so which is very good. And so it is very important, one, that we are able to look at innovative solutions, which is not going to wait for the service infrastructure to improve. We are also enabling those who need to seek the services to demand for more innovative services and better. For instance, there is a lot of opportunity to innovate in affordable services in India, in mental health care. What kind of innovation can happen? I'm sure there will be a lot more creative minds that in the next 5 to 10 years will come out with solutions for it.
Sure.
The last point here is also about the fact that India cannot afford to only look at treating problems that exist. We are not a Western country, and we can't get our people to only look at spending money on mental health care only. So there is a strong need for India to look at preventive angle.
True.
I really believe that we have to really understand what are those preventive aspects that we begin to infuse into our communities, various communities, from the community like family to schools and colleges and organizations at workplaces and all, so that we're looking at mental health from a preventive perspective, so that we are not waiting for people to come out with a problem and say that now I'm ready to serve you with a service because you have a mental health problem. We won't be able to afford that. So there is a lot of opportunity for us to innovate in the preventive angle also. All this require one thing. There is only one need, I would say, that mental health care in India always will have: leaders. We really need leaders who are visionary. We need leaders in every aspect of our life, our community, to say that, I think we have to look at mental health care from an inclusive perspective, which means that every single person of the community is a stakeholder of mental health care. We must become allies to those with mental health problem. We must create an environment which is very different. We must prevent the onslaught of mental health problem. All this requires leaders and a certain strong vision for mental health care.
You're so right, Manoj, on the preventive side. So it is also then changing the discourse not only about mental health, but also mental well-being, mental fitness, if you will.
Yes.
I think what we really need is a fitness revolution. Something that started in the India maybe 40 years ago with physical fitness. Gyms and people going to work out and run, etc. Now that has to transcend to the next step, which is to say, how can I be mentally fit? And like you said, stakeholders in various parts of the community, various parts of the ecosystem need to sort of come up. Especially, I would say even corporates as well, because a third of your living life you're spending with your employer, and there's got to be some way that they should be able to help you be mentally agile, resilient, fitter, and just look after your mental well-being. But great thoughts, Manoj. Thank you so much for joining us, and more power to what you do at the White Swan Foundation.
Thank you, Kumar. It was a pleasure speaking with you, actually, and thank you for highlighting the topic of mental health care. Thank you.
Thank you.